What's the most revealing thing that you have uncovered in your mind going through this project?
I honestly feel like there's a couple of things. One is the complete disregard for human well being and elevating greed to a level I couldn't have even imagined before getting involved in this. And I say that because they knew of so many harms that were happening to people. They saw how destructive the vaccine was. And yet they pushed forward with it because this was a gigantic cash cow for them. And I also feel like the FDA and the CDC and the White House all felt like we have to do something. We have to put something out there to make people feel better. Everyone's scared. And so they pushed through something that they knew wasn't effective and that they knew was at least potentially damaging from what's in the clinical trial documents. And now, when it's abundantly clear how damaging it is, it's still out there despite that. So that's what I think the push was for doing it.
You think it was just about money?
I think that was a huge part of it. And also trying to, one, perhaps see how controlled the population could be, and then trying to allay fears that they had created, both the government and through the mainstream media that was all on board with it. They created such a culture of fear that our basic society started breaking down pretty much. And I feel like they said, well, we have to do something, and we can tell them that you can take this vaccine and you can get back to your normal life. And that was one of their ways of dealing with the alleged problem that they created.
Yeah, and that's one thing that I I like to add to when we talk about the pandemic. I like to talk about it being government created, because it was government created, and whether the government helped to fund the virus creation in the Wuhan lab or not, either way, the whole blow up of the whole thing was government created. So the narrative was definitely coming down from the government, pushing the mainstream media to basically expose this fear, which, when we look back or even during, it's like, it's a virus. Our bodies have been fighting viruses for thousands of years, and it didn't wipe out our population. So why should we think that this one's going to? Even if it is man-made, it's still a virus, and viruses or, life forms always revert back to their most natural state. So anytime we've tried to modify a bacteria or modify a virus, it always goes back to its natural state. And when we think about it, a virus, it's not a very good virus if it kills its populace.
Right.
Because then it can't replicate to other hosts. To really think about all these deaths that were caused by this virus, I mean, I would really like to know the true number. And I personally think it's very small. The true number of people that died from primary.
Right. I think so as well. Yeah. And the denial of natural immunity when, like you said, we've been faced with viruses literally from the minute or even before you're born, because it's in your mom's body as well, but your whole life you're faced with those and your body fights them off. And then to say, no, there's no such thing as natural immunity, it's just crazy.
And anybody, especially that's in healthcare, whether you're a pharmacist or a doctor, or you're a nurse, and you had any kind of education on the immune system, to deny natural immunity, we've never done that before in the history. People that grew up in the 30s and 40s, they didn't get the measles and mumps vaccine because they already had measles. And for us to think that we can create a vaccine, whether it's gene therapy or a true vaccine, that is better than natural immunity is really, really arrogant. Really arrogant.
Exactly. I agree completely. And it was almost evil to tell people that even if they needed to get this vaccine, because you have from having, not only do you not need it because of natural immunity, but your body's got the spike protein in it already. And so that's circulating around. And if you've had it fairly recently, and then you get a vaccine on top of it, you're throwing another dose of the spike protein on top of that. And that's what, when you do that and it gets to a certain level that your body can't handle, that's when you really start having problems.